So everything started here, and this is the notebook of Louis Pasteur. As a regulator, this is kind of fun. You see the schedule is down where the lines are, and that's all to it. That's how he started. That's the way he basically ended the first rabies vaccination in humans, and it went well. If it did not went well, we'd not be standing here talking about all this. I don't know if, I don't think it was serendipitous. It was an incredible, and it wasn't a physician, by the way. Everybody believes that Louis Pasteur was a physician. He was a chemist, and that's why he made it, because he had the chemical mind at that time, not the medical mind, because in 1885, the medical mind was not there in the first place. So that's how he made it, and I'm a physician, so I think I can state this. How do you do this thing? Next. Okay. I was calculating what you guys have said. Basically, we are saving 5 lives per minute. So since the time we've been here, we've been saving a lot of lives, and that's what vaccines do. Let me ask you a provocative question. This is my job. How many of you have already gotten the flu vaccine in them? See? Not too many, huh? Next week, okay. Who's going to take it next week? Good answer. So that's also an important thing to do, to set the example ourselves. Because I agree with Bruce, the influenza is the mother of all this vaccination thing. Of course, without even implying pandemics and stuff. So we started from here. You've said everything. Then the recombinant DNA came. Then glycoconjugation came. Then reverse vaccinology. And what's interesting is what's coming. The structure of vaccinology is coming, the synthetic biology, and the adjuvants in human immune response. So this will open for more and more issues that are well beyond the simple transmission of disease, not only virus and other things. This is the hashtags I got from today. First of all, vaccine is a concept. And for those of you who have read and might like to come back to read Richard Dawkins, The Selfish Gene, 1976. That's an amazing book. That book states that, yes, indeed, a gene is the unit of transmission. So that's what hereditability is made upon. But it's another unit of transmission, which are the memes. You know, M-E-M-E. The memes are concept. They will parasite other brains. They will spread through other brains. They will diffuse. And then they will be even heredited, or you can vaccinate it upon. This battle should be fought, not only on biological backgrounds, but also on theoretical, philosophical backgrounds. Memes for how good is vaccine should replace memes of how bad vaccines are. This is a battle between ideas. So this we need to build a concept on vaccination, which is, do not underestimate the speed of memes. That's how social networks, by the way, work. One is vaccine stakeholders. You have heard this. So a short table, as usual. Patient are the first stakeholders. Healthcare representative in academia. You have heard what academia can do. Regulators, of course. Industry, because they have to develop the vaccine. And payers. Payers should understand that this is a value that is worth pursuing. The history of vaccine should be also brought up, because otherwise we are in the context of the actual thing, so we react. We don't proact, we react. So Ebola is an issue. But malaria is an issue millions of times higher than Ebola. And other communicable diseases are so important that we should not discuss the crisis, because it's good for momentum, but then momentum, have up and downs. This is not quite significant. Vaccine, as I learned from Bruce, is a system. So it's between vaccine and vaccination. There is a difference between the system of vaccine, which is a combination of a system biology per se and a system epidemiology per se combined. So that's another issue we should tackle, both in communication and in our policies. Vaccine research. We should discriminate between what you can do on a tremendous amount of information that are now built. A comment we made in the press corner with the minister is that we are on the verge of opening the vault of the immune system. And the autoimmune disorders and the immune system per se, it's an amount of information that is parallel only by the human brain. You know, John Blalock in 1980 again used to define this our peripheral brain. The immune system was our peripheral brain. Indeed, the immune system again is like the brain, is the only system who can react to anything that is injected, even if it's invented today. Is able to discriminate between our self and our non-self. And this is going to be an issue on which vaccine can open a lot of research. Vaccine trust, and in general trust in the pharmaceutical company. I've been talking this to several stakeholders lately. I don't know what happened with pharmaceutical companies. They have dispersed whatever they had after Second World War. You have seen the queues, people on polio vaccine. They were not queuing for bread. They were queuing for vaccines. And now they were gods. I mean, you know, pharmaceutical company were able, penicillin, major breakthrough. And now they've done much more than what they have done in 1950s. And everybody thinks they are scumbags. They are ridiculous guys. They are you know, getting their money out of patients. The level of trust in pharmaceutical companies is very low. And in this case, trust is essential because we are not even treating patients. We are treating will-be patients, but not patients. So the communication is also in telling you, so you're telling me I have to get something because in the future I might have a disorder and I'm perfectly now healthy. Yeah. And I am 6 months. So I'm not even able to have any consensus. So my parents are judging for me. So think about the implication on he's crying, I'm crying, everybody's crying, you know, I don't want to come back on this, and perhaps the next day the baby has some fever. And they are not all PhDs, you know. I have to tell you this. Most parents are not PhDs, believe it or not. So if the kid the next day wakes up and has a little fever, that's the beginning of the end. It's going to have all the reaction. And of course, internet is very helpful in this, right? Internet will give you a lot of information on the beginning of a disastrous road that starts with a little fever. Okay, so that is going to be very hard 24 hours. So vaccine is a combination, I'll give you the next two hashtags, between complexity and singularity. That is quite unique. Very other field of biology and medicine put together, the system level, we're talking about policy making, you know, WHO, US Department of Health, you know, all the EMA and all these things, at the very higher level of policy making, and down to the fact that you have to do this in a single shot, and please come back in a month because I have to give you the boost. So this is another complicated level, not only on communication, but on the level of our ability to then tackle this thing. And finally, vaccine future. Where is the future of vaccination going? And let me give you my last slide. It's going on this. It's going on into immune therapy. Of course, it's another concept of vaccines, but still they are vaccine. You wanna immunize against, as Professor Pecolelli said this morning, Helicobacter pylori, for instance, or other type of germs that then act upon other systems. So this is going to be something, it's an issue. And we better call the payers on this, because the level of the complexity and innovation of this therapy will then put a pressure on our system that will be very, very, very difficult to understand. So the HTA evaluation for completely preventing a disorder should be put in place, and I'm looking at my HMA fellows down there, when we sit at the management board of EMA, and we have to decide whether or not scientific advice plus HTA should be start in parallel. This is another example, because otherwise the hepatitis C story is only the beginning of the end of our health system. So taking out from this little, not so little, vaccine concept up to this very informative conference, which I thank you on behalf of the agency, on behalf of President Pecorelli, you want to say something? I thought so. And he will say something, and he will close. And so I thank you again. Thank you for being here. Thank you for teaching us, at least me, a lot of things that I didn't know. And see you, I think, next year. We have to do something, because we cannot drop the ball in a situation like this. So you are invited next year. We'll do something. Sergio, thank you.